Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, Facebook, and Instagram. I'm Kimberley Cartwright, News and Public Affairs Director at WNCU 90.7 FM. I'm your host, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. During COVID-19, much of politics has been the search for a compromise between safety and the effects of the virus and the social and economic needs of voters. The COVID-19 pandemic has made politics extraordinarily relevant during this time. How do politics shape what we know about COVID-19 and how we govern ourselves as we move through this pandemic? My guest today is Dr. Jarvis Hall, Associate Professor of Political Science at North Carolina Central University, and he's here to help us to wade through all of this today. Hello, Dr. Hall, and how are you?
Hello, Kimberley. How are you doing? I hope you're doing well today.
I'm doing exceptionally well today.
Good.
Yeah, we're going to talk about your neck of the woods, the thing that you specialize in, politics. Is politics more than politicians making rules and laws that citizens must follow? That is your first question.
Well, the first thing you have to remember about politics is that at the core of politics is power, and the ability of people to get out of the political system what they want or what they feel they need. And so we can never forget the centrality, if you will, of power involved in politics. And power can be very complex. It can be nuanced. It's not just me being able to make you do something that you wouldn't ordinarily do. It's all about how you play the rules of the game, how you get issues on the political agenda. It's all about your consciousness and whether you think that you have the ability to impact the political system in a way that will help your particular interests or concerns or the concerns of your community. So power is at the core of anything political.
Wow. Okay. So give me your opinion about this statement. Politics is at the core of the COVID-19 pandemic, regardless of jurisdiction, the specific actions many governments have taken to combat the pandemic are ultimately rooted in politics and not in science.
Well, to some extent, that is true. Science has to be there because it is a pandemic. And so at one level, we have to rely upon the scientists who have been trained in this area and know what the pandemic is all about, where it came from, and what we have to do in order to get out of it. Now, the thing is, those people that we rely on to help us get out as a community, as a state, as a nation, and as a world are elected officials. And so because they are elected officials, we have to remember again this notion of power and the fact that elected officials, the number one self-interest of an elected official is to be elected again. Okay, so everything they do is built around that. And so you can look at what a politician does in terms of the pandemic or in terms of other issues, and you look at how it relates to how it impacts their number one self-interest, which is re-election. And sometimes that could be good and sometimes it could be bad. It could be good because if they want to be reelected, they would do things that would be in the best interest of the people who vote for them. But if it could be bad because they may do things that is not necessarily directly addressing the problem. And that has been especially the case with this pandemic.
So how do we know the difference? I mean, we're following our leader. We're following people who we hope will act in our best interest, but a lot of times we don't know that they are until there's a big story in the news saying maybe there is some form of corruption or maybe there is some influence on that particular politician that's not in our interest. So how do we know? Or do we just trust?
trust, unfortunately, has been one of the major victims of our politics in the last few years. A lot of the politicians are not generally trusted. The approval rating for the United States Congress, for example, has been in the single digits. And that's unfortunate because these are people who make really significant decisions that have an impact on our lives in all sectors, healthcare, education, transportation, all kinds of stuff. But from my perspective as a political scientist and as somebody who works in the area of political behavior and civic engagement, is that I believe and I promote the idea that citizens have to be active participants in their own empowerment in our political system. They have to be involved. And democracy is not a spectator sport. It requires us to be involved, to pay attention to the media, to get good information and facts. And unfortunately, another victim of all of this that's related to trust is the truth. Who's telling the truth? How can we depend on this particular news source as opposed to another particular news source? And so, but we have to hold elected officials accountable, but also as citizens, we have to be accountable to our democracy. And that requires us to be involved, to be informed, and then to take action as individuals and as groups of individuals in order to make sure that what we are doing is in the best interest of the community as a whole.
Okay, next question. Do you feel that political affiliation had much more influence on Americans' decision to stay home during the COVID-19 pandemic than did the numbers of infections in communities?
I think so. Unfortunately, we are in a very polarized society right now. Republicans and Democrats, red states and blue states, and whatever is bubbling up now when we think about these very right-wing organizations. And when it was clear that our former president wanted to minimize the impact of the pandemic, that became, it made it a political issue. He politicized the issue, and his enablers politicized the issue to such an extent that you could probably tell if you went somewhere that the people who wore masks were, I won't say most likely Democrats, but certainly those who did not wear masks, probably the majority of them were Republicans, because they saw that as a symbol of what the person who they had identified as their leader, a symbol of his approach to the pandemic, which was one of minimizing it, because he thought that, of course, the pandemic would hurt his number one objective, which was re-election. And because you want things to be going smoothly if you are in office, and especially at the top of the national ticket, you want the economy to be going well, and everybody to be happy. And that was not the case with the pandemic, because certainly it impacted not only the health of our citizens, but certainly the economy also.
So I want to talk about the United States vulnerability. How vulnerable is U.S. society during COVID-19?
Well, in this global society we live in, where travel is so open, and or at least prior to the pandemic, we have people coming in and out from different countries. There's a lot of mobility within the United States, people going from one state to another. And some places in the United States are hit harder by the pandemic than in other places, and so with that mobility, with the transient nature of our world, it makes it easier for a virus such as COVID-19 to survive and thrive. They rely upon that. Um, Otherwise, of course, you would have to shut everything down and isolate everybody and just put everybody in the bubble. And, and that's not something that the American people would be amenable to, I know.
Okay. This question, then, to follow up what you're saying is, this may be $1 million question, but how do science and information and politics strike a balance to move through the pandemic?
Well, what we need is good leadership, and especially at the top, but also in the middle and at the bottom. And everything, with this being such a national crisis, it is imperative that those who make decisions about where we wear a mask or not, whether it be required, what businesses and activities are shut down, vaccinations and all that kind of stuff. It's imperative that those decisions be informed in a big way by science. It's just critical, and you can make the argument that for much of the pandemic, because of the last administration, the previous administration from the one we have now, they were adverse to relying upon science in order to make very important policy decisions. And so I think what we see in the current administration is more of a balance, because again, because many of these officials are elected officials, politics is going to be a part of it. But you are right. It has to be a balance between politics and serving the interests of the people and trying to give the people what they need and want, and the science itself, and sometimes you have to make decisions that won't be very popular, that may in fact be adverse to your number one interest, which is re-election, because the science is telling you that this is something that we should or should not do.
Okay, in politics, and especially politics of the pandemic, there are losers and there are winners. So can we talk about some of the losers in the pandemic?
Okay. What the pandemic has certainly done, and a lot of people have talked about this and written about this already, is it has just exposed many of the structural factors that have led to gross inequalities in our country. And so those who are on the margins of society, those who do not have the luxury of working from home, those who may be living in a very crowded housing areas, those are the big losers. I won't say big losers, but the pandemic has certainly hit them harder than any other group. And of course, those who may have had chronic conditions already and were more susceptible to even catching the virus. And of course, we know that communities of color disproportionately have chronic diseases, heart disease and diabetes, and certain cancers. And so, the pandemic has hit those who are already doing poorly in our society. And again, it's exposed these inequalities and structural factors that already existed.
So let's talk about some of the winners. Who's winning in the pandemic?
Well,
I mean, it's kind of like weird to say winners and losers, but there are people who are faring better in the pandemic.
The drug companies should be doing well, and they will be doing well because of our reliance upon the vaccinations, and just the opposite of some of the people that we just mentioned, those people who are able to work from home, who are able to isolate themselves effectively, who are able to establish bubbles and not be exposed to the possibility of catching the virus. Um, um, I think, too, at the beginning of the pandemic anyway, and I haven't looked at these figures lately, but interestingly enough, the environment did get better because people were not traveling as much, and air pollution got better. Crime in certain areas actually got better again because people were not moving around as much. I think that has sort of tailed off a little bit, though, as the pandemic has progressed. But it's in things like this, especially a national crisis like this, it is always interesting to look at, who are the winners and losers, and you're always going to have winners and losers in anything. Some are very apparent, and some are not. And I think what the country needs to do is we have to look at one, how do we avoid a pandemic like this again, or at least minimize it, because it might not be possible to avoid pandemics. When you read certain literature about the inevitability of pandemics in the coming years, but and then how do we recover from that? And I think more importantly is, even if we recover to where we were before the pandemic, for many groups, that wasn't very good, in terms of employment, in terms of education, in terms of the criminal justice system. So how do you recover from the pandemic, but then how do you take us to another level to improve society itself for more people?
Okay. We have come to the end of our conversation, sir. And it has been delightful as always. Thank you for sharing your time with us, Dr. Hall.
Absolutely. It's always a pleasure to have a conversation and a discussion with you, Ms. Cartwright.
All right. So, audience, you've been listening to COVID Conversations here on WNCU. Thank you so much for watching on Facebook and YouTube and Instagram, as well as listening to WNCU 90.7 FM. Be sure to like us, follow us, and subscribe to our pages to see more of our archived shows. I'm Kimberly Pierce Cartwright, your host. Until next time. Thanks, Jarvis.
Bye.